So once we are discharging a patient, on the day of discharge we give them a lab schedule that from the day of discharge till the next year 365 days which test they have to. We give them all charts like medicine charts, diet chart, exercise chart, so they know what is to be done.
Benefits of black coffee on liver.
Correct.
Is black coffee really good for liver?
Yeah. So there are multiple papers for that also.
Impact of alcohol in females versus males.
Yeah, this is very important thing, because impact for of alcohol on female is very high as compared to male.
The liver doesn't ask for much, yet it quietly works every day to keep us alive. It filters toxin, processes nutrients, and keeps our system running smoothly. But when the liver begins to fail, the body starts to lose its balance, and life can change in an instant. For thousands, a liver transplant isn't just a medical procedure, it's the last hope. It's the moment when science meets survival, when waiting becomes praying, and when one's life loss can give another second chance to someone else. Today's episode doesn't just explore the life saving miracles of liver transplant, but it also shines a powerful light on the profound gift of organ donation, where one person's loss becomes another's second chance at life. This is the story of liver transplant, what they are, when they are needed, and how they offer not just more time, but the chance to truly live again. Joining us today is Dr. Dinesh Zirpe, Director of Liver Transplantation and HPB Surgery at Sahyadri Hospitals. Dr. Zirpe is a renowned liver transplant, pancreas, and hepatopancreatobiliary surgeon with over 500 plus liver transplants and over 1,000 laparoscopic surgeries to his credit. Dr. Zirpe is known for his expertise in living donor liver transplant, pancreatic cancer surgery, and advanced laparoscopic procedures. A recipient of the Young Scholar Award in GI surgery, he combines surgical precision with a deeply patient centric approach. An All India topper with gold medal in his kitty, his work addresses complex liver, pancreatic, and biliary conditions using cutting edge techniques, and he leads a multidisciplinary team that is committed to world class care. Hello and welcome to another episode of Sahyadri Health Talks. And today we have with us Dr. Dinesh Zirpe, continuing our conversation on liver transplants from where we left it last time. So, sir, last time we discussed about what is liver transplant, who are at the risk, and how do we determine who needs a liver transplant. And also we spoke about the donor part of it, what is MELD score, and all those prerequisites before requiring a liver transplant. The patient goes inside an OT. We have discussed that section of it. Now coming to the next segment, which is the actual game changer, which is the liver transplant surgery. So take us through the entire phase of it, like how does it happen, what happens during a surgery, and how does it typically look for a patient who is undergoing a surgery.
Correct. So once the committee happens, means as we discussed in last episode that committee clearance is most important for a living donor liver transplant. For a cadaveric transplant, it is registration for the zonal transplant committee, and once they get the cadaveric donor, they've been called. So either you'll get a call from our coordinator that we have a liver available, or you know that the surgery is planned after 3 days, and somebody from your family is going to donate for the donate the liver. So in both cases, obviously, we have a proper protocol of a video consent, in which in front of video we tell them what is going to be the process, what has happened up till now, what will happen on the day of surgery, and what is the post-op course. So normally, let us talk about living donor liver transplant. So before a patient goes for a surgery, there is complete evaluation, 4 stages for the donor and complete evaluation for the recipient. Means
as
how is the heart of the recipient, is it doing well, or is there any major issue? Same thing for lungs. So we completely evaluate a recipient also, so that we know that he can sustain that much stress during the transplant.
because it's a huge surgery.
Correct. So for a recipient, it is like you are going to take out a bad liver, and then for a donor, it is like we are going to cut the liver into two halves. If it is a adult recipient, means we have to give liver to a big person, then we have to give right
fully
lobe.
grown person.
Correct. So then we have to give right lobe. If it is a child, then we have to give a left lobe, which is a smaller, because in child you cannot fit the big liver. So that's why according to that we decide which side of the liver we are going to take. So most of the times for adult it is a right lobe of the liver. So we take out the right lobe, and then we do some backbenching process where we have to attach some grafts, and then we implant those that donor graft into the recipient. That is called implantation. Okay. So for a donor it is just going for the surgery. For a donor it is completely general anesthesia, so they do not understand the surgery has happened because they are under complete anesthesia. So that's why they do not have any pain while undergoing the surgery. So the normally most of the times incision is like reverse L incision, where we open and we see how is the liver. So normally we always tell the family that in donor and recipient, donor is always the priority. So if at all any issue with the donor, if you feel any risk extra to the donor, we can cancel the surgery. So that's why we take first donor as in the operation theater. We see by look is most important, means we have done CT, MRI, but seeing the liver is most important. So that's why we see the liver after incising the abdomen, and if we feel that okay, liver looks good, volume looks good, then only we'll ask the recipient to be taken for the surgery. If at all we feel that there is some doubt, some issue, or it is extra risk for the recipient, the donor, then we will not proceed with the surgery. So overall the chance of this happening is very less than 1%. But important thing to tell is that of the two things, obviously donor is always the priority. So once we go ahead with that, okay, now the donor liver looks good, then we will call the recipient for the surgery. Then he also is being given the complete anesthesia, that is general anesthesia. Once the general anesthesia is given, then we start the procedure. So for him also most of the times it is reverse L incision. Once the incision is given, slowly we take out that liver, and then we use the donor liver and implant that into the recipient. That is called implantation. So average surgery it takes around 8 to 12 hours.
8 to 12
So for donor it is around 4 to 6 hours. For recipient it is around 8 to 12 hours. And so everything has to be coordinated.
And it has to be done at the same time. I mean,
correct. So the time where we are taking out the right lobe from the donor, the same time the recipient's complete liver has to come out. So as soon as it comes out, then you can put the right lobe into the recipient.
Okay, so that's
a coordinated.
That's a coordinated kind of thing. What has been the most trickiest and lengthiest transplant surgery that you have done?
So obviously, as I told you, that every transplant is a challenge. Every patient gives you something new, challenging thing. So for all the transplant, the important, complicated or complex things are like the patient having portal vein thrombosis. That means the liver has the dual blood supply. One is hepatic artery and one is portal vein. So 80% of the blood supply is given in by the portal vein. Around 20% is given by the hepatic artery. So some patients before transplant only they have the portal vein thrombosis. That means their portal vein is not working well. So by nature's blessing, sometimes they get the collaterals. That means around the portal vein you will get some collateral. But those are not very natural veins. So using them for joining it is very difficult. So we have to take out that thrombosis, and then the new liver gets the blood only if that thrombosis is out. If the thrombosis is not out, how the blood will come from the portal? You understood? Like you have a tap which is blocked, and you are going to attach something in front of that tap, but there is no water in that tap. So taking out that thrombosis is most important thing. So, and if that doesn't come out, which is less likely possibility, but if that doesn't come out, then we have to give jump grafts, like blood supply from somewhere else. But overall the outcome is not that good as the native portal vein uses. So that's why we always want to use native portal vein by taking out that portal vein thrombosis. Some patients may have a hepatic artery thrombosis, like artery is not well, then we have to find other artery, or we have to go down as low as possible to find a good arterial chunk, and then only we can join. You cannot join to artery which is thrombosed, correct?
True,
So
true.
both blood supply are important. So most of the times things are good. Sometimes you may get that portal vein thrombosis. Rare times you get the hepatic artery thrombosis. But in one case we got both. The patient had portal vein thrombosis also, and he had hepatic artery thrombosis also.
Oh,
So that may happen very, very rarely, because
very rare.
that patient had HCC, liver cancer.
Acha.
So in case of portal vein thrombosis, but that cancer was inside the liver, so the thrombus was not the tumor, but the tumor was inside the liver. Now to burn that liver cancer, what you have to do is transarterial chemoembolization. That means
Acha.
you use some catheter, go into that hepatic artery till that tumor, and then you block the vessel to the tumor. So while doing that, sometimes there can be the arterial puncture, which can block the artery. So unfortunately, with this patient, that artery got blocked after that procedure.
Blockage happened.
So the supply was not completely blocked, but it got dissected. So that means the supply was not so good, so that new liver can take up. So we had to find new way. We had to join
so
that
basically you
liver.
had to fix that first.
Correct.
Before you did the transplant.
No, correct. Yeah. So once we take out that liver, we fix that. We have to take out the thrombus on a ongoing blood flow.
Yeah.
So that is quite risky. And then you join the new liver with that portal vein and then that hepatic artery. So the other issue is, if it is blocked, the higher chance that it may again get blocked.
Oh.
So that's why that is also a important thing we have to consider, that after surgery also it may get blocked. You have to be on toes to again redo it if at all it blocks.
Achha.
But good thing that it didn't block. Now it is more than a year for that patient.
And how long was this surgery?
So around 14 hours.
14 hours at a stretch.
Yeah.
So is that the longest duration of surgery?
No, so one we did, it was around 26 hours.
26 hours.
Yeah.
Oh my God. And 26 hours of dedicated focus.
Correct.
Okay,
so it is always a coordinated procedure. So that's why we have to then take a stop on the donor if the recipient takes some time. So we cannot take out the liver unless and until we are ready for the other part of the procedure. That's why it is coordinated. So if somebody is lagging behind, that other person has to wait till the time that person comes to the same level.
Yeah, so it's much of a very coordinated teamwork, at the same time keeping multiple factors in consideration. The entire procedure happens. To help us understand the post transplant recovery. How does that happen, and how soon can a patient jump back or bounce back to regular life?
So most important question they would ask is, what is the success rate of this transplant?
Yeah, actually, as I already, sorry to interrupt you here, but as I already spoke about this, the fear of organ rejection, which is there almost in every layman who is undergoing a liver transplant, is quite high. And as you said, that with the advancement in technologies and the science, medical science, the rejection rates have been drastically reduced. So how do you convey this to the patients, and how does the post recovery look like?
So basically, overall, in a good patient, in a standard liver cirrhotic patient who is not very sick, the success rate is around 90 to 95%.
Achha.
So obviously the risk is there 5 to 10%, which involves all the major issues like infection, bleeding, thrombosis, the things getting blocked, or re-exploration or rejection. But overall, with the new advances, most of the chances of complication has gone down.
Achha.
So obviously we want that no patient should have any problem, and everybody should go home with at early as possible. But the patient response to the therapy is different. Some patients recover very well, some patient take some time, some patient drastically have different outcomes. So that's why we have to explain all the risk and complication to them. But overall, as I told you, that overall success rate is very good. Now the second question is regarding donor. How much is the risk for the donor?
Yeah.
So because he doesn't have any problem, but still he's donating the liver.
Yeah.
So overall risk to the life is very, very less, which is like 0.4%.
Achha.
So that's why to make it less, we have to do complete evaluation in all stages, and there shouldn't be any major issue in the donor evaluation. So normally once the surgery happens, post-operatively donor is around 3 days in ICU, and then 3 to 4 days in the ward. Most of the times donor gets discharged on day 7. Regarding recipient now, recipient is average 5 to 7 days in the ICU, which is a transplant ICU, and then 5 to 3 days in the ward. And depending upon the recovery, then the patient gets discharged. So those who are from remote areas, we ask them to stay in our city in Pune for 1 month.
Yeah, actually, I was coming to that part also, that how do you keep a track of these patients who are coming from outstation?
Correct. So once we are discharging a patient, on the day of discharge, we give them a lab schedule that from the day of discharge till the next year, 365 days, which test they have to do. So that way they do not have any confusion that which test we want to do, what to do next. That is one. We give them all charts like medicine charts, diet chart, exercise chart, so they know what is to be done. Now only thing that those who are from the remote areas, that area also the doctor may be worried that, oh, this is transplant patient, I may not be able to manage. So what we tell them that 1 month you stay in Pune, we see how is the progress, and then if the things are well, then most of the times you don't need anything further. The only thing is doing a proper lab test, and then we have a WhatsApp group. So when we discharge the patient, we form a WhatsApp group where our team members and the family members are there in the group. So you know what is the day today? Can you tell me what is the day today? What is the function today?
It's a transplant day.
No.
Then?
We are shooting today on this day. I'll just give you the hint. What is the day?
Okay, Raksha Bandhan.
Correct. Yeah. So what I personally feel, no, it is like Bandhan with the team. Once you do the transplant, no, it can't be like, oh, dhala transplant. We have done the transplant, now we are done. It's not like that. It is obviously, it has a long-term relation. So once you do the transplant, you take the responsibility that yes, now we are as a family members, and then anytime in the future also, if they have any issue, they have to come to us, because other people, most of the times remote area doctors also, they are not well versed with the managing transplant patients. So that's why that confidence they should have with the team, that yes, we will be taken care. That is one thing. And once that group is there, if any issue is there, any family member can put. So most of our team members are there, or we normally give one 24/7 helpline number also, so that if there any issues there, they can call.
They can reach out to us.
Correct.
Okay. So now talking about that last part of the entire process, which nobody wants to talk about, is the complications. So what are the common complications that a patient can expect, or do we see?
So patient should not expect any complication. That nobody expects the complication. Yeah. So now what they should know,
preparing for the worst.
Correct. So what they should know. So one is infection, because immunity we have to keep down.
Yes.
Second is any complication regarding the liver related implantation, like if it is joining of the artery or vein, the thrombosis like blockage, or there can be some leakage, so maybe bile leak or bleeding, or sometimes 2 to 3% chances that re-exploration. So if there is any bleeding, we have to again go for the surgery and close that bleeder. So then sometimes there is called delayed functioning, like the liver which was functioning very good in one organ, one body, that is not functioning so well in the other body. So that time it can be a primary non-function, which is quite serious issue, like not at all functioning, which is very, very rare nowadays. And second is delayed functioning. That means the liver is taking more time to work as a normal liver. So that time you have to be more careful. We have to prevent infection in those cases. So these are important major things. So biliary issues, like when we join bile duct to bile duct, sometimes when it heals, it may get strictured. Means normally we say सिकुड़ना, मतलब छोटा होना. So stricture is one thing, or leak होना, मतलब bile leak होना. So most of the times it can be managed conservatively. कभी-कभी sometimes endoscopy we do, and you do the stenting. With that also it gets managed well. And if that doesn't get managed with that, sometimes you may require a re-surgery or re-exploration. So other than that, other organ involvement means how your heart, your kidney is responding to the new liver. That is also very important. So sometimes kidney doesn't function well, or it gives little bit trouble, or heart troubles. Sometimes arrhythmia happens. The beating of heart may get haywire, or sometimes lung may get an issue. So overall, we explain everything to them. The chances of complications are getting lesser and lesser over the over the time that more and more advances are happening.
Okay. Now, moving on to the next segment of this podcast, which is Mythbuster, and a few questions which are like rapid fire. But these are more towards, this can be something related to the liver health overall or something related to transplant.
Okay.
So I'll read it out
Sure.
and let's bust some myths. Let's get some facts straight.
Sure.
Yeah. Protein supplements are good for liver. Myth or fact?
Yeah, they are good in a good quantity, not very high quantity. So everything is whether it is drug or a food. If you take in a good limit, it is good. But over the limit, it will trouble.
So people who are too much into gymming and fitness, they have a tendency of taking protein shakes, right?
Correct.
So do you recommend that, or should they?
So overall
stick to-
protein intake is around 1 gram per kilogram to 2 gram per kilogram. So according to that only they should manage. So taking too much of shakes or too much of whey protein also, it will trouble.
It will trouble. Oil versus ghee versus butter, which is better?
So obviously, I hope my mom is not seeing this.
I'm sure she is.
So anyways, it is traditional. So ghee is very good. But I do not take it very routinely. That's why I said that.
Okay.
So because one thing is, it's like you cannot make everything in ghee.
Yeah.
Okay. So it's the same thing. It's a quantity. So you can have a good quantity, but the quantity can't be beyond your water intake. So sometimes it is ghee. Everything is ghee only, so it is troublesome. So in a good quantity, maybe the quantity deciding it is a little bit difficult. It can be individualized, but 2 tablespoon, maybe 2 teaspoon, depending upon the patient's overall thing. Because if the patient is having fatty liver and he is watching this and he's saying, no, doctor said that ghee is very good. Abhi to khana padega. So that's why it is individual thing. But overall, if you want to compare, preparing food, obviously you cannot make in ghee. That's why oil is important.
Oil is important.
But oil, you can obviously, it is not required that it has to be olive oil also. You can use mustard oil. Other oils also, it's for, but the quantity should be less. So in ghee and butter, obviously ghee is preferred because it can be obviously used by the lactose intolerant people also. The smoke index is less, smoke index. That's why it can be used for multiple preparations. So that way, I feel ghee can be preferred over
a preferred option. Okay. Benefits of black coffee on liver.
Correct.
Is black coffee really good for liver?
Yeah. So there are multiple papers for that also. That
and it's also called as a natural detox for liver. Is it true?
So natural detox is
detox is a word which is being used everywhere so much.
Correct.
So they say black coffee pee lo, liver apne aap ko detox kar dega.
I think there are some words, they have very good impact on your mind.
Yeah, very catchy.
Like that, the one is detox, the other one is Goa. So whenever you said that let's go to Goa, that itself gives you a good feeling.
I think let's go to Goa is a common discussion in every friend circle.
So I think the detox is same. So natural detox, it has been utilized for multiple things. So what was the question?
The question is that is black coffee really good for liver?
Yeah, so black coffee is good. It decreases the fat in liver. It is they are saying it is anti-cancer agent also because it reduces the incidence of HCC, malignancy in the liver. However, it shouldn't be this higher number. Like average 2 to 3 black coffee should be. So now if you add sugar, then sugar free is a major problem. You shouldn't add sugar free. If it is with sugar also, sometimes it is okay, but it shouldn't go over the counter or over the limit.
Achha. Okay. Impact of alcohol in females versus males.
Yeah, this is very important thing because impact of alcohol on female is very high as compared to males. So if you see binge drinking is like somebody is drunk so much that is not able to go home. That is one of the definitions. But there are multiple definitions. So average one definition is like 4 or more drinks for female and 5 or more drinks for male. So now why it is less in female and why higher for male? Because the absorption of alcohol is very fast in females.
And the reason behind it?
So normally they say this sometimes estrogen receptor is the one of the culprit, but exact pathophysiology is difficult to be.
But then absorption rates are proven to be.
So that's why
higher.
All limits for a male and female are different. So if you see for all criteria also, the amount of alcohol for a female is always less because it impacts more.
Because
That's
it
why
gets absorbed faster.
Correct. So because that's why they say if two college mates are there, they start drinking alcohol, a male and a female. The female may have a liver cirrhosis earlier as compared to a male friend.
Acha. So impact of alcohol bad on females.
Yes.
What happens if my condition worsens while I'm waiting for a liver transplant?
So that's why we discussed that the living donor liver transplant is the only way where if the patient is going down, his MELD score is increasing, he is getting repeated admissions, then somebody from the family should donate for that person.
Okay. Does drinking water after alcohol really helps your liver? We are talking about flushing it out.
Yeah. So obviously it will dilute. So you know that if you eat anything, it will go through the intestine digestion. But if you drink alcohol, it will directly go to the liver. So 90% of it goes to the liver. So more it is diluted, more it is better. But now if your the quantity is also has the importance. So if you are anyways going to take 4 things, then I feel it won't matter that much. But it is always better if you want to reduce the absorption. Maybe food and water will have some effect on it.
Okay. Is eating too much sugar just as bad as alcohol for your liver?
Yeah.
I think this debate is going on for quite some time. Is sugar more, is sugar worse or alcohol worse?
Oh, okay. Can I ask you one question?
No.
I have to. So many you have bombarded, I can answer.
Okay. It depends on if I want to answer that or not. Yeah, come on.
No, I'm not asking personal question, don't worry. So one thing is, if somebody is jumping from the 5th floor, or somebody is jumping from the 10th floor,
okay, I can see where you are heading.
The dangerous thing. So same thing. It's like jumping from 5th floor is like sugar, and 10th floor is like alcohol. So sugar obviously lesser the floor, less harmful. Maybe if you're jumping from 1st floor, it may be less harmful. So if the sugar amount is going up, then the overall toxicity. Basically, toxicity means the calorie intake goes up, and if you are not utilizing that calories, then it is going to trouble you. Means if I give you 1,000 rupees and you utilize 1,500 rupees, so 500 you have to give from your pocket.
My pocket.
The same thing. So if you are eating 1,000 calories and utilizing only 500, the 500 calories are going to stay with you, and then it might get deposited in the tummy, maybe in the liver, in the form of fat.
So be it sugar, be it alcohol, both are bad.
Correct. So everything in limit is not bad.
It's not bad. Do detoxing with juices or supplements actually help your liver? Are there any supplements like juice or something which can do the magic?
So if you search on Google, you might get hundreds
Google
of products.
Will tell me कि आंवला पी लो उससे भी liver ठीक हो जाएगा.
So, I do not believe in the detox thing with the juices and chemical products.
And see, that is the reason why I'm asking you. It should come right from the expert.
Correct. So primarily, what is the problem? According to that, we have to tackle the issue. Having a healthy lifestyle is the key. Okay, so now in that what you include, it is obviously independent choice. Somebody would say avocado is good, somebody would say apple is good. So that obviously there is no debate in that. No.
Yeah.
So same thing. There are some juices it will be helpful if taken in a good amount. But most important thing is having a good lifestyle, which includes diet, sleep, exercise, and stress-free life. So if you have a good diet, good dietary habits, good exercise, then I think things should be okay. Now, if you're drinking alcohol regularly, then obviously that is not a good thing. So we have to have a gap in between. If normally they ask what is the safe limit of alcohol.
Yeah.
So there is no safe limit of alcohol. So if you why to trouble the liver? Now if you wanna trouble. So sorry to many of the
to disappoint many.
Yeah.
There's no safe levels.
Correct. So but if at all you have to drink, then there should be a good spacing in between. Good abstinence in between.
Okay. Craziest thing you have heard patients say about the liver?
Yeah. So I had one patient. So normally when patient comes to us, we ask, oh, okay, what is the problem? Okay, what's happening? Do you have any abdominal distension? So we ask them that do you drink alcohol? So they say yes. And when was the last time you drank? So that's the same. One person came to me, said, "Sir, I'm having liver problem, very serious problem." I said, "Yeah, no problem. We'll see." So I asked some basic history, and I asked, "When did you have a last drink?" He said, just. I said, how, when? He said, just. I said, who brought you here? So that was, so he said, no, sir, I thought if I had, I should take the medicine also now. So I can consult the liver specialist. I said, then, oh, that's a good idea that we can put our banners at every wine shop that have a drink and have a consultation. So,
take one sip and come and visit us.
yeah. So I said it doesn't work like that. But see, he has not lost the insight that he needs.
He needs a treatment.
So
Okay, so beer is not an alcohol.
same thing. So it is an alcohol. Yeah, just let's not shy away from the facts. So same thing. Obviously, concentration is less. So the amount normally people end up in having more. Okay, but I think for social drinking, maybe it is a better idea to have, if at all you want to have the beer, or you want to have the drink. But it is an alcohol.
But it is an alcohol. So that's about that. Okay, sir. So now, we have spoken about liver transplant and everything about it. Also, we have spoken about live,
Living donor.
living donor.
Correct.
And the other part is the cadaver donors, right? The brain dead patients. But no matter how much we talk about it, there is a lot of resistance still among people when it comes to organ donation. Though, I mean, it practically is something that you are no longer a part of this world, but your organs are going to be so much of help for somebody. So if you have to give out a message or say something about that to every listener of this podcast, what would that be?
So one thing we should know that not every person who is dead can donate all organs. Most of the times, what they feel that after death, all organs can be donated. So the liver, heart, kidney, intestine, these all organ only can be donated if the patient's heart is pumping, but
Acha.
brain is not working.
Acha.
So that's why the overall then domain goes very narrow.
Acha.
That's why every person who's died on the spot
Or
obviously
traffic
cannot
accident
be a donor. So now those who have brain issue, brain hemorrhage, brain death, and their family is willing to donate, then only that other organs, maybe it is liver, heart, lungs, kidney, pancreas, so that can be donated, provided if the family is willing for that.
Acha.
So unfortunately, we do understand that there is a trauma to the family.
Yeah.
But unless and until the person has himself told to the family beforehand that that is my wish, that the organ should be donated.
So basically pledging.
Correct. So pledging is most important in that thing, that if somebody genuinely wants to donate, then their family members should know that thing. That is one. Second, I can tell you one story, that we had one patient who was on the list for kidney transplant. He had chronic kidney disease. So he was on dialysis. Unfortunately, he could not get the kidney. But however, during the course, he developed brain hemorrhage suddenly, and his brain was not working at all. That person's family, they decided, unfortunately, we are not able to get the kidney, but our patient's liver is good, so we will donate the liver.
Achha.
And we got that liver to my patient. He is doing wonderful. So his bilirubin was 32. He had 1 year of child. So he was so much desperate that he should get the liver, but unfortunately he was not able to get. Luckily, just because of this patient's family's decision, currently his bilirubin is 1, which is from 32 it is gone to 1. So that is the power of the donation, that you keep on living. A single person can make 8 people's life better. You keep on living forever. So I think that message has to go to the all people
out
those
there
are
in the
willing
community,
for the same.
that first of all, the scope of donating these vital organs is very narrow. So at least pledge your organs, and if somebody can
correct. So what people feel, most of them, that if we pledge that our organ may not be taken care properly or anything like that, but that is not the case. Means brain death is 100% surety, then only the organ will be donated. So normally they ask what is the surety that 100% brain is not working. So that's why, according to the government of India only, when the declaration happens, it happens by 2 different doctors who are not part of the transplant team. So that's why, and it happens 6 hours apart. So if we feel that the patient's brain is not working, they have to call some neurologist or some physician. He comes, he checks, and once he declares, then again we have to call somebody else after 6 hours to again check. And if both of them they are saying that no, this patient's brain is not working, then only the organ donation happens. If two doctors are telling you that the patient's brain is not functioning well, that means it is irreversible damage. So the patient is not going to wake up, patient is not going to get survive. And that's the point when the option of organ donation is given to you.
So before we let you go today, we would want to hear some stories from you. We know you have a pitara full of stories, so many stories. Some I have heard, and one story which has been really challenging and which has left a mark on your heart.
Yeah, so we have many stories. As you know, every transplant itself is a story, because it is either a donation from an unknown person or a donation from a known person or a family member. So there are instances when we see that the bond is so strong that it doesn't require the stamp of a relation also. So see, we had one recipient who's sick, who required transplant as early as possible. So he had two sons, one sister, one daughter. So the first son said, no, I will donate. I don't have any issue. So we did a workup, but unfortunately he had fatty liver. Second son said, I will donate. So we did workup, but unfortunately he was also having fatty liver. So the third daughter also was not medically fit. So what happened is that the patient's daughter-in-law, that means the first son's wife, she spontaneously said, no, I will try. I think my blood group is, I think, same. So it was no force, no this thing. It was a spontaneous thing, and she is an engineer. So when we could see that it was quite a spontaneous thing, and she was quite caring about her father-in-law. So, and after surgery also, so she donated. Her workup went on well. We did the transplant. It was quite risky transplant. Went on well, and after that also, the way we could see, she was taking care. All medicines, all the charts, all timetable, she was maintaining. So I think that is one of the best example that how relations are there to make each other strong,
and how blood relations might not work at many situations.
Yeah, but still have means if you have the bonding, that is the most important thing, means to do something for the other person. Same thing, see, sometimes what happens is like we had one son was willing to donate, but father was not at all ready to take. So he said, no, I will not take my son's liver. I have enough of my life, I will not take. And son was quite behind him that, see, so what is the thing that nobody can decide how many years you are going to live. Age is just a number. So age cannot age cannot be the only factor on which we will decide कि नहीं यार इनका 70 साल का उम्र है तो नहीं करते, इनका 40 साल का है तो कर लेते हैं. Sometimes 70 साल का आदमी 40 साल के आदमी से भी ज्यादा strong healthy रहता है. So what we normally feel that we should give chance to survive, chance for the second life for every patient who are medically fit to undergo the transplant. So what we said, see, the patient, मतलब उनके पिताजी अगर ready नहीं तो हम आपका कैसे लेंगे. Then he convinced his father that no, dad, you don't worry, we will go ahead. And then just before going for surgery, the dad calls me and tells, whatever happens to me, no problem, but do not let anything happen to him. So that becomes obviously we are trying to do our best only. But medical field, we have to explain that there is a risk. As I told you, it is 0.4% risk. So we are not gods. And operation went on well, but that emotional thing always remains with us that okay, that father was so much. So it is all the time it happens, like all relatives, everybody, they know that this donor is not having any issue, but he is donating. So that way we remain connected to them.
Okay, so we would like to end this podcast with a clear message from you for top 5 things that every patient who requires a liver transplant must know. So what would be those top 5 things?
It's a good question. See, normally when we see YouTube now, so I was seeing one action camera. So in that they say 5 things you should know before you buy the action.
And that works crazy.
Yeah, I think that is genuinely.
Yeah.
So maybe it is good mainly for the patients. Like they should know that these are the important. So obviously,
and yeah, also it also kind of sums up the
correct,
entire
correct,
discussion,
yeah.
right? So what
So
would be those 5 things?
correct. So most important is the patient should understand. People should understand that liver is indispensable organ. Means there is no replacement for it. So like if you have dialysis, we can put the patient, if the kidney is not working, we can put that patient on dialysis. But liver is indispensable. So if it is going down, we need to bother about it. We need to take a decision at right time. So that is most important thing. Second thing, there is no RSA, like roadside assistance for liver failure. Means if your car is not working well, it gives you some indications. Okay, but you don't wait till it stops on the road, because if you stop on the road, you, if in the car you still have roadside assistance, but for in the life you do not have RSA for liver.
Yeah, so there's
That's
no
why-
RSA.
Yeah, so you shouldn't wait till the time things are, patient goes in organ failure. Third most important thing is faith on the doctor. See, as a liver transplant surgeon, as I told you, that we know what things are going in the patient's mind. So nobody will do a transplant unnecessarily. If it is required, if it is going to save the life, then only it is, we are going to tell that thing. So unless and until you have faith on your surgeon, I don't think you should proceed for the transplant, because that is the most important thing. That bond has to be there, bond between a surgeon and the patient. So that has to be maintained.
So that is the third thing.
Correct.
So these are the 3 things. Moving on to the fourth one.
Follow outcomes.
Achha.
So outcomes in liver transplant are very good. Obviously, you have to jump one important thing. You have to take a jump from pre-transplant to post-transplant. So there is some risk, but the outcomes are definitely very good. So if you do not jump, the risk is going to be there continuously. But once you cross that line, you are post-transplant, you have crossed 1 month, overall risk goes very, very low. So that's why they should think that the transplant is not like so big phobia, but it is a solution for your current problems. So that's why outcomes are good, that they should remember. And now fifth
one?
thing, follow up. Means once you undergo liver transplant, do not miss your doctor's instruction, because if everything goes well but still you stop your medicines, you again go on having a bad lifestyle, then nobody can save you. So follow-ups.
Follow-ups. So that was 5 points from Dr. Zirpe for any patient who needs a transplant or knows someone who needs a transplant. This discussion was indeed a beautiful discussion, and I think we had to break it down into 2 episodes because there was so much of content to cover in this particular topic. And thank you so much for coming out of that OT and giving us this time and such huge amount of time that we had such a lovely discussion on liver transplant. On that note, thanking you once again and hoping you to see again on this platform of Sahyadri Health Talks. Until then, this is Dr. Tushita signing off Sahyadri Health Talks.